Dear member of the Health and Community Committee, you're hereby summoned to attend the special meeting of the Health and Community Committee, which will be held in the Council Chamber, Guildhall, Derry, on Tuesday, the 26th of March 2024 at 4 p.m. Roll call. Alderman Nairi McMorris. Alderman Janice Montgomery. Councillor Lillian Barr. Councillor Jason Barr. Here. Councillor Paul Boggs.
And Shaw.
Councillor Caitlin Deaney.
And Shaw.
Councillor Caroline Devine.
And Shaw.
Councillor Gary Donnelly. Councillor Alex Duffy. Councillor Sandra Duffy. Councillor Conor Heaney. Councillor Aisling Hutton.
Shaw.
Councillor Catherine McDade.
Only.
And Councillor Brian Tierney.
Here. Thank you, Barry. Members, you're all very welcome to our special meeting of Health and Communities. The next item on the agenda is the broadcasting statement. I would like to remind everyone present that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. If you're seated in the lower public seating or media areas, it is possible that your recording cameras will capture your image and that this will result in the possibility of your image becoming part of the broadcast. By entering the council chamber and using the press or lower public seating area, you're consenting to being filmed and consenting to the use and storage of those images for broadcasting or training purposes and for the purposes of keeping historical records and making those records available to the public. If you wish to avoid this, you should move to the upper public gallery. A copy of the council privacy notice may be found on the council website at derrystrabane.com. Okay, members, item number 4 is declarations of members' interests. They can be shared now or as they arise throughout the meeting. None. Okay. Members, you'll be delighted to hear that I have no chairperson's business, which means that we can move on into the business of today's meeting. And I just want to inform members that our first deputation from the Quorum Centre are unfortunately unable to make it, and the committee are trying to reschedule that, so they won't be presenting before us today. So item number 7, as we jump down through this agenda, is to receive the Buddy Bear Trust. We've got Mr. Brent McConville, Chair and Founder, along with the Principal, and Jen Corrigan, the Trustee as well. So I'll hand over, and as usual, we will have a presentation from our guests, and then an opportunity for questions and answers from the floor then. So I'll hand over to yourself, sir. Thank you, and you're very welcome.
I'd like to thank the chairman and the staff here have been very helpful, and yourselves for listening to me. I started off this charity 40 years ago. I was conned into going to a meeting. Instead of getting football tickets, it was to raise funds for a child born with cerebral palsy in Dungannon. And when we listened to the mother talking about the nightmare of being told that a child is severely disabled, so as the meeting went on, I was forced to take the job as chair because my full-time job was education officer, and I appointed all the principals to control schools and work with maintained schools. So I became chairman, but I didn't know how to deal with severely disabled children, and certainly to see a baby crippled at 6 months old or 4 months old was destroying. So I said, I'll help. And then some parent in the crowd said, we saw a television program about some school in Hungary that our medical terms was fix the child. So we tracked it down with a couple of the businessmen, and we happily got to the stage of knowing what school was. And then we discovered, there's a document in front of you, it says Pedo Institute. And we discovered there that the British government...
Just talk on the microphone, Brent. Some members are struggling to hear you. Just put yourself forward.
So, is that any better? Sorry, I'm getting over a cold. So, we discovered that Britain had invested 5 million in the Pedo Institute to train teachers and to help pupils. So we wrote to them, we phoned them, and was packed. So then we decided that we would go over and see them, and we did. And we then came back and went to London to find out why money wasn't sent over to Northern Ireland. And they said it's all in the devolved government pot. So we then set up a committee to raise funds to take the child to Budapest to see if they could teach him something that we couldn't do. And in the process of raising funds, we raised 20 children who wanted to go and who needed to go, including 2 from Derry, who complained bitterly that it was a long journey. And I then thought, well, why not, as education officer, why not try to open a school? And we did. And the Hungarian Pedo Institute and government agreed that we could open a school and they would supply me with teachers or special conductors. And we were delighted at that. And then we realized we would have to raise money to pay them and keep them going, because the education board that I worked for said they're not the normal children that we work with. And I said, but if the British government find that it's useful, then it's useful for the ones in England, Scotland and Wales. So then when we were there looking for teachers, we met Lady Diana, who was looking for teachers for Britain. So it can reaffirm that this was necessary. So the show that I'm going to display, I'm going to give you, is the efforts and the need for us and you, because there's lots of children around here with cerebral palsy that we know we could help if we could get them at about 3 or 6 months old. Now the principal's here and she'll talk a wee bit about what conductive education is.
Hello, my name is Ildiko Verish. I'm principal of the Body Bear School in Dungannon. And as Brendan says, we were hijacked about 1989 and brought to Dungannon and made to work really hard. Well, the end result of that was I stayed here and I was made principal in 1993 when the school officially opened. The school at the minute, what we achieved is a school is registered by the Department of Education as an independent special school. The reason why it's an independent special school is because in those days, if we wanted Catholic and Protestant children to be able to come to the school, it had to be independent. And because a disabled child, you can't look at anything else but the needs of the child. So unfortunately, that hit back because now the Education Authority is not duty bound to tell the parents that the school exists because we are independent. So at the minute, we have 4 children in the school that we are getting the fees paid for. And the rest of it is fundraised by me, Brendan, and a couple of trustees and a couple of volunteers. And that's going on now from 1993. So we are not a grant-aided school still. Parents are fundraising on top of the looking after their children. So it's a very stressful situation. As Brendan said, conductive education that originates in Hungary, but now it's available, widely available in the whole world. Conductive education was developed by Dr. András Pető, Professor András Pető, who tried to approach the problem, physical disabilities, from education rather than therapy's point of view. It's based on neuroplasticity, which means if one part of the brain is damaged, you can build out new pathways with plenty of practice, motivation, encouragement. Definitely not once every 6 weeks for a half an hour. That is not going to teach anybody to walk. These children come to the school. They are not sitting in a wheelchairs. They get out of the wheelchair as soon as they come in. We have 20 children on roll at the minute. We have a mother and child group. That means from 3 months old, we work with the children and the mothers at the same time. So if the child is only coming to the school for an hour a week, that means the mother can follow up the program for the rest of the week because we teach the mother how to work with, how to help the child and how to teach. That's the mothers are dying for this. They want to know how to help their children. And as if we get the children really young, we can prevent contractures. We can stop deformities setting when the child is 3 years of age. And physical exercises along with the national curriculum for the children. So everything happens under the same roof. Conductive education is a holistic approach. It looks at the whole person. Our aim is not to keep the children in Body Bear School forever because we are getting fees for them. Our aim is a meaningful inclusion. Inclusion is a big thing. It's very nice. But for the child to be pushed into a normal classroom with normal, in brackets, normal children who are able-bodied, you just physically doubly disable them. They won't be able to participate. Yes, they will look nice. They will sit dignity because they are totally strapped into their chairs. What we do in Body Bear, we teach them to sit. We teach them to stand. We teach them to hold on things. We prepare them for school. So by the time, as soon as they are ready, we are ready to send them on to another school, a normal school, let it be a special school, but they will be able to participate and do things for themselves and help themselves. It's okay to have the child in the wheelchair, but the child is 18 years of age and the mother, let's say 60. She will not be able to lift that child out of the wheelchair and take them to the toilet. We even toilet train the children. So I don't know if I'm making any sense, but we teach everything under the sun. You don't go to separate physio, you don't go to separate occupational therapists. We're not stones throwing. What they are doing is probably right, and conductive education using the elements of physiotherapy. But there's not enough of them and the children can't get enough, so they can't make any progress. Children who come into the Body Bear School and stay in the mother and toddler group or mother and child group, as we call it, they make the best progress and they are the majority of the school. We had a couple of children over the years from Derry who made good progress, but unfortunately they couldn't keep up traveling up and down the road. First of all, they either didn't have the time or the parents were working, or it's just the petrol cost too much, so they couldn't afford it. So what we achieved so far is the school is registered. We have 4 conductors, including myself. I'm a working principal, so don't have time to take too many phone calls. But we have a mother and toddler group. We have 2 school groups, one for older children and one for the foundation stage children, and we have a nursery group. The mother and child group, as I said, the mothers working along with the conductors and the children. We are also registered with the General Teaching Council for Northern Ireland, so we are registered teachers and we are regularly inspected by the inspectorate and we are getting glowing reports. The inspectorate recommended to the EA to work with us, which unfortunately they didn't take up that opportunity as yet. Yeah, you can chip in.
A child coming to us that can do nothing, and then watch him. There's a child here, you may see, put up some of the slides there. 1 wee second, if you look at the screen, there's a little girl there, and there's a boy, that's the Derry child. He could do nothing when he came, and now he's in his local primary school in Belfast, and the mother enrolled him into the football club in case they'd ever play against Tyrone. So the other thing is, that's him there, you can see he's working, he's taught to lift his feet, to walk over the steps and the ladder. So if we worked hard and we asked different people for help, just flick it on another one.
Just you say next slide when you're ready.
Next slide.
The gear,
Next,
just
so
flick it on.
that's Westminster, and they wrote the document that I gave you, that children were entitled to receive conductive education, but over here we were living in the dark ages, and now we work with your political people, and this gentleman will tell you, I tortured them with phone calls, and John Hume came down and helped us at the very beginning. And the other man that helped us, and if you look at your thing, you'll see you have a Triangle of Hope photograph. The Hungarians wouldn't give us teachers because they said we lived in the middle of the murder triangle. So we formed a Triangle of Hope. And the ad that I put in the paper was bigots are wanted. But you have to be a bigot. You have to have a friend who's a bigot on the other side. So we got 3,000 of them. And if you look over to the side at the very top, it tells you John Hume. Then the next one is David Cameron and Robin Eames. Down here, down the bottom, if you look, you'll see Dr. Paisley's name. And go up by 2 or 3 inches, and you'll see Martin McGuinness, and he's squashing out John Paul II, the Pope. But we brought the story to everybody. We've told the Education Board, the children we always have to take the Education Board to court. And it puts a stress, not on me, but on the parents. And I think a mother that has a child with a disability should not be tortured by bureaucracy. So the Children's Commissioner came down last week. There's a breath of fresh air in education. There's a new chief office. There's a new head of department in education. And somebody has moved into the Education Authority. And last year, the Education Authority said that special education needed an extra 450 pupils, and it terrified parents of children with all sorts of learning difficulties, including ours. And then 6 months later, the Education Authority said they needed 1,000 places. Now, anybody that carries out surveys like we did in the Education Board, you see a bulge coming through, you don't suddenly find that you need 1,000 more places. So once we took the photograph, you can see I got John Paisley, Hume and Taylor to help out. The 4 church leaders who also came here to support the Derry children took the time out to go to Budapest, not to Budapest, but the railway. The flights that were taking us to Budapest were in Dublin. And if you look at the next one, the photos, it's the children from Northern Ireland that we took, and we looked after them in Hungary for a month. And that's what opened the door to give us a chance to get conductive education. So, go on. I'm okay. If you look at that, people who helped along the way, there's Martin and Ian Paisley. They brought us up to say that the Assembly had agreed to fund the school. And the whole Assembly, I have left the papers here for you, or will send them. It gives you the views of every person at the Assembly, and they all said the school should be funded and supported and encouraged. And I contacted all the unions regularly, and recently we met your 5 political leaders when they weren't able to talk to each other. And they've all signed a document that they want you to sign, saying that the school should be funded and supported. And thankfully, somebody used their brains that they have appointed a new minister, Mr. Gavin, and he's coming down to the school next month at some stage to see how they can help. But see, the letter from the 5 politicians have opened the door, and the sponsors that sponsored us said, could you help any more children? So they asked me to go to Derry and Belfast to find out would the Derry people be interested in having a school up at here providing conductive education. And I'm asking the council, can they help, and in what way can they help? Is there a piece of accommodation that we could get, a former school, whatever, because that's what we took over, a derelict school in Dungannon. We refurbished it, and that was all done with volunteers. I helped put down a laminated floor. which is not what normally education officers do. But anyway, they asked me to find out, and this is the best way of doing it. If you give us your support, you could be giving a child a chance for life and lift an awful pressure from the mother and the family, because we now help them prepare their case for the Education Board. If necessary, we'll get a volunteer solicitor. And at the moment, the BBC has asked, they would have come up to cover this meeting because they said their reporters have seen the progress and have come into the school and have followed children. And so maybe the next time we come back to you, or if we can get longer to explain it, but we're finally saying the inspectorate gave us the all clear, and they actually said the Education Authority should continue to place children in the school. So the Education Authority is wrong. It's breaking the law. And I'm looking through with solicitors to find out how we can help. But the main thing here is, if you look at some of the slides, that's the dairy boy in blue. Couldn't walk. The wee girl is sitting over here in red. Mother was told that the child had severe cerebral palsy and was unlikely to walk or be able to lift her hands, and she had cortical visual impairment, so she wouldn't be able to see. The wee girl now goes to her normal school for 4 days a week, and she comes to us.
Yeah, sorry, Brendan, just to interrupt. We could tell you stories every day that would break your heart with these children. These children are born, something's wrong. They tell them to take them home, love them to death, and just love them. That's not enough to help these children because they are capable for so much more. And those children who were coming up from Derry, and if they stayed with us, they would have been further on, they would have been more progress. They would have been possibly able to get out of a wheelchair or sit back or make themselves a cup of tea, but they couldn't stay long enough. So what we are actually looking for is a space in Derry, somewhere where we could operate from, like a satellite school, and then we would be able to have more children.
And I'm heading over.
This wee boy, sorry, who you see, who's standing with the blue jumper, he came to us when he was 6 months old and he couldn't do anything, and the mother was told he will never do anything. He's back to normal school now and has absolutely no problems. If he has a problem, then he's able to come back to us for a backup or just a consultation. But we are able to, not medically, but we are able to diagnose the children. We know what's wrong with them. But what we are focusing on is not what the child can not do. We are focusing on what the child could do or can do at the minute and build on that. And it's everyday practice. That's what helps them.
So what I'm asking you to do as well, I realize you're listening to a lot. I need your support to help the children up here. It's a big drive from Dungannon to come up here. And I'm trying to go to Budapest next week to try to interview and get 2 expert teachers to come with us. And Belfast is looking support as well. Now, I want you to sign a document that you have, that the politicians drafted, not me. This is your politicians, and it makes good sense to us. And if you can follow it through, it'll help. 2 weeks ago, one of our children was 7, and we had a birthday party for him. And we had him from he was 5 months old. And he's 7, and he can do a lot of things, but he can't walk on his own yet. So when the birthday party was over, everybody went back into their rooms that they were working in or playing in. And he sat at the table. And his mother said, "What's wrong with you?" He says, "I'm waiting on my real birthday present." She said, "But you've got it." "No," he said, "my real birthday present, I was told that when I was 7 or 14, I would grow out of this and I'd be able to walk. So he said, I'm waiting here until I'm able to walk and look, I can wag my feet. But he said, I can't stand. And I'd like to know why. So I have to say, it sort of made everybody wet round the eyes. And we're working hard with them. And there's a young couple from Derry now that they have seen, you probably saw it anywhere, maybe get the mother to come in with the child. There was a child from Derry here, a wee fella called Harry. And he made remarkable progress. And we had the family had a function up on and I have told the junior officers, if you cause a parent to cry, then I said, we'll go public. As one of our parents, she was asked to fill a form in, and they kept saying to her, she was only a young girl, they kept saying to her, put the father's name down. She said, no, there's no father involved. And they said, don't be silly. She said, no, is not involved. Obviously, she felt embarrassed. And finally she said, I'm only trying to get into the school. And the child's name, the father's name is not even on the birth certificate. So he said, why would you punish a child by not letting them? So she's going for an appeal. Now, I'm conscious of your time and I don't like wasting it, but there are children up here that I came here to meet the chairperson, and before we left, by talking to your staff, we identified 4 children that possibly could benefit from it. And that's your own staff in here. And if we had the school up here linked into Ildico to keep in charge of it, a satellite school, then that's what we need from you. And we'll work with you to try and get it, or take deputations up with the Parliament, not the Parliament, the Assembly. And ultimately, I'll go to London and find out why they didn't put in extra money for this new agreement. If we need an extra, we have to raise 200,000 a year to keep the whole thing operational. And that's with none of us getting paid. None of the trustees get paid. So we're doing it on a voluntary way. So you could help your own dairy children and lift an awful worry from the mothers, because men put problems into wee compartments. But when you talk to a mother, a child with cerebral palsy, one of the first things they may ask, will my child be able to stand when she's making her first communion? And the next one is, will my son be able to walk when he's going to the secondary school? And at the end of our documentation here, you'll probably see it, or you saw it on television recently. A young woman of 33 came to our school with dark sunglasses because she had been in bed in a dark room for 12 years. And 12 years earlier, at the age of 15, she thought her skin was on fire if she touched anything. So she couldn't touch anything, and her mother couldn't give her a hug, and you couldn't put a face cloth over her. And she couldn't eat anything because she couldn't touch the taste of, said was like touching a blowtorch. So she was tube fed. She came to Ildico and the girls, and she said, I'm 33. I've lost my childhood,
It's the last.
my teenage years. And she said, what can you do to help? So Ildi and the team worked with her, I think, for 2 years, isn't that right, Ildi?
Yeah.
And now the girl appeared in a play in the Skillings.
That's our last slide there with Shelley on. As you can see, Shelley was 13 and she was lying in a hospital bed, then at home for a couple of years, and now she relearned to walk.
So she can walk and her sight's slowly improving. And she said she's trying to relive her teenage years. And she said it's really difficult when you're 33 to act like a teenager. So I don't know, did the photograph go up?
Yeah, that's the last slide. I don't know if you have this picture of Shelley.
Hello, there should be one, the very last picture.
One more.
No, that, you see the wee girl standing, that's her when she came. That's a big girl. This is Shelley here. Ildiko had to get down under her legs to stop her from collapsing.
Yeah,
It took about 2.5 years.
that's right. So we have plenty of success stories. So I think we took up enough of your time. I don't know if you have any questions that we are more than happy to answer.
Okay, thank you both very much for that deputation. And I think it's clear to see from the slides that there are some success stories, and I'm sure there's probably a lot more that you could tell us about. It's at this stage now that I'll open it to members on the floor to see if there's anyone with any questions. Councillor Deeney.
It isn't a question, but it is just to welcome you and thank you for that presentation. You obviously do incredible work and your stories are so touching. And as we can see here, you're the experts, we're happy, to read any of the concerns to our MLAs and happy to sign the proposed resolution that you've put in front of us, of course. We believe all children have the right to an education and to the best possible start in life. It's obviously clear here too that conductive education works wonders, with these beautiful stories that you've shared with us. And as a teacher myself, your focus on the holistic approach and inclusion is so important, and I like the way you touched at the start too on training for teachers to cope with the needs of the child, because I feel like this is so needed at the minute in schools as well. But thank you so much, and anything we can do to help support you, we would be more than happy on behalf of Sinn Féin. Thank you.
Thank you, Councillor Deeney. Councillor Barr.
So much to speak to us, and I already knew about your organization. I remember when I came here, I was researching support for children with autism, and I came across your organization because I have a child with autism. He's now a young man. I was particularly impressed with your presentation today, where you mentioned about the mother and child program. I had the opportunity to travel few years ago to India to attend a 1-year program on mother-child to look after my child, and it was the best training I've ever attended, because it just did support me, supported my family, my child, and the independence that he has right now. It's because of that training that I went. So I really appreciate the work that you are doing. It's really disheartening to learn that you're struggling with finances and funding support. And this is a common theme when it comes to Section 75 groups, where it's normally become like an afterthought. We're not really looking after people with additional needs in this country, and I really hope that that will change, because those children are a blessing to our families. And the families that really get the support that they need, they end up becoming very independent. Looking at the work that you do, I spent a lot of time yesterday looking at this presentation, and my heart, honestly, it was the best presentation. I was really looking forward to come and meet yourself, just to say thank you for the work that you do. And I am sure that as the SDLP, we will sign this, and anything that we can do will absolutely, you can count on our support. So thank you so much for that.
Can I say,
Yeah.
am I on?
Yeah, you're on. Go ahead. You're on.
That if we are setting something up with your help, obviously I'd want a few people from here to be trustees. Not the charter. Well, the people need to know that they're being cared for. I spend a lot of time with new parents who have been traumatized by somebody not telling them until a week or 10 days later that the child's head was damaged when they were taking them out by forceps. Now, women think differently from us. They instantly thought, what else? The child living, will the child be able to stand? Will the child be able to go to primary school standing? Will they be able to meet other people and communicate with them? And that all those thoughts are simultaneous with women. Sorry about that, but I don't want to ridicule them. I'm praising them. So we're here to offer our help, and the mere fact that you'll put it in the paper, it'll hopefully let some young parents know if they come down to Dungannon, we'll work with them. And if we can get facilities up here, and I need help to raise, obviously, money until the Education Board takes over. And if the Education Minister comes down and sees what we're doing and sees the proof from others, Ildico, more modest than I am, but the spirit of Northern Ireland for the best school for education. So I think that's pretty good for, and then the other thing, we collectively won the Pride of Britain. And I'm the only one in here that has Simon Cowell's phone number. So when they all come up to the top table because we had won it, and they come up to say hello, and we got stacks of photographs with them. So Simon says if they're ever over here doing something, he'll give us 50 or 60, free seats. But I'm going back to talk to him because he has 137 million in the bank.
Very good. Thank you all very much. I'm assuming, sorry, Councillor Hutton.
Sorry. Thank you very much for your presentation. It's just really a comment that I wanted to make as well in relation to sort of the stops tour that we have got today about Body Bear. I work in the community and voluntary sector, and we've been tasked at the minute in building resilience within our young people in schools. And to me, this is a prime example of how to build resilience in any child or young person. You're preparing them to go back into that mainstream school where they will grow and develop. I'm a board of governor in a local school here with a child with cerebral palsy, and I've no doubt in my mind that if they had access to this service, it would have been an easier journey for the school, for the parents, and particularly, most importantly, the child. So just to comment that I'm really glad I'm here today to find out what Body Bear's doing. I think it's an amazing initiative, and as I say, if putting resilience into those children to get them into mainstream school, then this is something here that we all need to be looking at and expanding upon. So thank you very much for widening my knowledge on it as well today. Thank you.
Sorry if I can just say a few words. I must say, and this is working for all this disabled children and adults as well. I'm not saying we can achieve the same result with everybody because there's no two children the same, but they definitely not leaving the school without making progress. And we are not hitting them with a shovel. So that's just everyday practice. So I don't want to build up hopes when there is no hope, but there is always hope. So you need to help us to help them to help themselves, if you know what I mean. You see clearly yourself that inclusion, the way they imagined, it's not working. You have to enable that child to be able to do something for themselves before you will them in the classroom. And I would rather have them walking into a classroom either with 2 tripod sticks or walking sticks or a walker. But they feel active.
Can I jump in on part of that?
Yeah, we just need to wrap it up because we've another.
Yeah, I know,
deputation.
but if you let Brendan carry on, then he will. That's why the school is still here and open.
Were you people not told that we have taken over and they're bringing sandwiches shortly?
Thank you very much, and you're more than welcome to visit the school anytime.
And
Call and see what we are doing.
There we go. I'm looking around the floor. There's no further indicated speakers on this deputation. So,
that word about the teacher.
yeah, Councillor Deeney.
I want to make it clear with teaching, I was a special needs vice principal. And I didn't deal with special needs in the board. There was another team did that. But one of the things that I did suggest to them, and I will re-suggest it, that children with special needs should be assessed every year. Our children are assessed regularly. And then every year we can show the photographs to the mother, the text to the mother, and the exercise. Now, I'm trying to work out how the education board arrived at 450 a couple of months ago, and a couple of months later, it went up to 1,000. And they have flooded the school system with classroom assistants. The question I'm asking openly is, when is the child with special needs, whether it's autism or language or whatever, actually being taught? For how long have they been taught? One of our children was making great progress. She could get out of her wheelchair, walk over to a table and jam a piece of bread, leaning against the table, of course. And the mother was tortured during the appeal process, and she said, I can't stick it. And she pulled out, and she was a mother on her own with 2 children, and just pulled out. The board said, we'll put your child into a school and with a classroom assistant. And they did that. And the child has been wheeled everywhere. And the mother contacted me recently and just said, my girl has put on an awful lot of weight and she couldn't possibly walk. And she said, why is the school not doing what you're doing? Or why are they not sending us for twice a week? So we're trying to accommodate the children. And with your, even meeting us today will give hope to some of the parents. And when I write something in the paper, I will be saying that. And that was one of the things I said to the Pope when I met him, when he saw that photograph and he signed it. The bishop with him said, the Pope only signs encyclicals, doesn't sign this. So I said, well, he signed it. And the Pope kept us for an hour and a half in his sitting room and offered us the opportunity for Mass. And the Cardinal had told him that I was a keen painter, not a good one, but a keen one. And the Sistine Chapel was closed for 2 hours to give us 2 hours walking around it. So we're going to get walking around the Guildhall.
You're more than welcome to walk around the Guildhall anytime, Brenton, anytime at all. Look,
When you're finished, if you want to take a group photograph, I would love it.
Yeah.
I'll put it in the paper.
yeah.
And
Well, look, we're gonna pause now. There's no further questions. We're gonna have a short interval where we change over the deputations, and if members want to make their way outside, we can get a group photograph. If that's what if members are happy, with that. Barry's not taking it. But look, just on behalf of the committee, first of all, just to thank you for your attendance here today. And for all of the work that you're doing. Members have already offered their support, and you've left the resolution for people to sign. I'm sure everyone will be content to sign it and leave that.
if they send us a copy of the email.
Yep. No, but they'll sign it now and give it back to you. Yep. No problem at all. But look, just once again, thank you very much for your attendance. And we're going to just take a short recess. That we switch over deputations and have a group photograph. Thank you. Thank you. Okay, members, if we can settle down, we'll get going again. Thank you very much. Item number 8 is our second deputation, and we have Alexa Moore, Policy Campaigns and Communications Manager, and James McGoldrick, Health and Wellbeing Officer from the Rainbow Youth Project. You're both very welcome. Apologies for the slight delay in getting round these, but we're here now. So just like the last deputation, presentation from yourselves and then an opportunity for questions and answers from members. Okay, so over to yourselves.
Hey everyone, so thank you very much for having us firstly. My name's James, my pronouns are he, they, and I'm a health and wellbeing officer. I look after specifically the adult services in Derry and Strabane, as well as our regional services in the Western Trust area. So I'm just going to extend my apologies as well. I may have to step out a bit early, so apologies if I'm not here for the Q&A section. So along with me is Alexa, who I'm going to pass over to shortly. Not here today is my colleagues Emer and Colleen. Emer looks after the adult services, and Colleen looks after our Rainbow Youth Services. But we have other staff as well, our council staff and peer mentors. But if we go to the next slide, yeah. So I'm just going to give a quick overview of what we do within our organisation, who we are. So the Rainbow Project is 30 years old this year. We are the foremost LGBTQIA plus health and wellbeing charity in Northern Ireland. We provide support across the entire country and available for people who live in the Republic who want to come over and access our services as well. We have centres in Belfast and Derry, but myself and a few of our colleagues provide regional support so we can reach people across the whole country. We work in and around different topics to do with health and wellbeing for LGBTQIA plus people. We work in partnership with different organisations like Victim Support, PSNI, NHS, Housing Rights, Equality Commission, many different partner charities within the sector, and a number of other organisations. We get on average around 120 to 150 referrals per month for people looking for our services. As you can see, there's a few of our services listed, ranging from our sexual health support, which includes rapid HIV and syphilis testing, available across the whole province. We work a lot in partnership with the GUM services and this particular project is funded by the Public Health Agency. So all of the testing that we do also counts towards the public health statistics. We also offer co-cultural counselling, meaning that all of our counsellors are also LGBTQIA+, and it allows people that ability to know that they can access a counselling service that's free, where the counsellor understands their identity. They're able to work on the support and services that they need without the barriers of explaining identity for. And our counselling service is available for our youth as well as adults. And the youth starts from 11, 12 upwards, be from secondary school age above. We also offer mental health advocacy, which is a unique service that provides like a holistic wraparound, parent in the health and wellbeing support as well as the counselling support, just to look after all of the holistic needs that a person may need. We offer family support, which includes support for parents of LGBTQI plus kids of any age, just for parents who may not understand what kind of supports that their child needs, but also to help them in developing their support ability. We also do migrant, refugee, minority ethnic support for anyone who is LGBTQI plus. We work in partnership with other organisations as well, but we look at the full holistic services that someone from the BAME community or someone who is a migrant, refugee or asylum seeker who also identifies as LGBTQI plus. We do hate crime and housing advocacy and violence advocacy support as well. And then we have our different youth and adult social groups, as well as different events and workshops throughout the year that we offer. Within the Derry area, we have our centre here in City Centre, but the Rainbow Project is unique in Derry in that the Rainbow Youth Service only exists in the Derry and Strabane area. We are the only organisation, the only LGBTQIA plus organisation in the Derry and Strabane area, both for youth and for adults. But yeah, if we can go to the next slide. So in terms of the demographic of people we support, it is quite difficult. We are what we call an invisible community, meaning that people can choose not to disclose their identity if they don't want to, which does make it harder to identify how many people are LGBTQIA+, how many people may be in need of our support. As I was saying previously, we get about 120 to 150 referrals per month across the entire province. But within Northern Ireland, we estimate that there's around about 210,000 LGBTQI+ people. That's based on research that we do ourselves, census data, as well as research from organisations like Stonewall and other academic support. But with us being an invisible community, it means that if people choose not to disclose their identity, that can have negative impacts towards their well-being as well. People can have heightened senses of isolation, which is something we see quite a lot, and everything that then brings upon. It also means that we aren't born into our community, unlike many other people. We have to seek our community. So a lot of people can feel like those experiences of isolation. And it means that if someone doesn't know what services or supports out there, they can suffer alone. A lot of the service that exist in what we would consider like the mainstream may not be fully equipped or fully capable of supporting the unique needs that LGBTQI+ people face, which is where we offer to step in. We also do training for many services to help services come along. But we also look at the intersectionality within the community. As I said previously, we have support specifically for minority ethnicity, migrant, refugee, and asylum seeker. We also look at the impacts of minority religion among LGBTQI+ people, as well as disability, neurodiversity, intersectionality towards many aspects of identity. And then if we go to the next slide. And then just a quick overview of the different organizations that do exist. There is, of course, ourselves, and then there's Here and I, which specifically supports lesbian, bi, and trans women. Carafriend, which is more youth orientated. Both of those are situated in Belfast, but offer support across the province as well. The three of us together would be the bulk of the LGBTQI+ sector in Northern Ireland, with ourselves being the largest of those. But there's also Transgender NI and Mermaids, which support specifically trans and non-binary people. And then Stonewall, which is UK-wide, that we work a lot with as well. Across all of us, I believe there's about 55 employees across the entire sector in Northern Ireland. So it is something that 210,000 people being supported by 55 people. It's quite a lot for that. But as I said, in terms of a physical presence, Rainbow Project are the only one that have an actual physical building outside of Belfast. So we're quite unique here in the city. And then if we go to the next slide. Oh, sorry, that is the end of the slides. Yeah. But I'm going to hand over to Alexa, who's going to talk about our policies.
Thank you so much, James, and thank you all to the Health and Wellbeing Committee for having us here. It's really great to be down in Derry. So my name is Alexa Moore. I use she/her pronouns. I'm the Policy Campaigns and Communications Manager for the Rainbow Project. And you know, as James said, we kind of work across Northern Ireland to support and advocate for LGBTQIA+ communities in the region. And hopefully you've kind of gotten from what James has talked about in terms of, you know, referrals of around 120 to 150 people per month as an individual organization. The amount of individuals that we do support and who do need that support, and that's not even counting those who may not know about us, who may not feel safe or comfortable or out yet to come to our services and to kind of express their identities. The reality is that, you know, a significant number of these services that we provide, the hate crime advocacy service, you know, specifically, especially our counselling service, which is really important, have been developed kind of as a partial remedy for failing statutory services and statutory services that are just simply unable or ill-equipped to support the LGBTQIA+ communities that we serve. Many individuals receive kind of substandard support and care if they are lucky enough to be able to access statutory mental health services. Our counselling service ensures that service users don't have to explain their identities or experiences and are treated with that kind of respect and affirmation, regardless of their sexual orientation or gender identity. Sometimes when someone goes to a mental health service, you know, be it here or kind of elsewhere, they may get a counsellor who has never met an LGBT person before or has never supported an LGBT person before. And in our service, that just doesn't happen. You know, they're all LGBTQIA plus. We all have that community background, and we can kind of, you know, understand the experiences a little bit better. So it's a really, really vital support. Currently, our waiting list is around 6 to 9 months for that service. So that should illustrate the kind of level of demand for those services and also the kind of lack of funding and support. You know, we have, I'd say it's between 5 and 10 counsellors across Northern Ireland doing this work to support countless people. And there's so many people that we're just kind of turning around to and going, look, we can talk to you, we can have a conversation, but unfortunately we can't deliver that counselling for another 6 to 9 months, and that leaves folks stranded. As well as that, you know, the Rumour Project in Foyle, or kind of our Derry office, receives no funding from this council for providing these kind of vital services and an essential community hub right here in the city centre. And I'm sure I can extend this invite despite the fact that I don't work there all the time, but I'm sure you would all be welcome down to our Derry office to see the kind of the hub for the community. And it's such a bright and positive and lovely space that we'd really love to have you down. So any work that council members or officers could do to kind of consult with the team in place and ensure that they have a fair shot at various funding streams and kind of ensuring the sustainability of that service would be really, really appreciated. And we understand that everyone's asking for money right now. You know, there's no two ways about it. But the reality is, you know, within our community, there's rising levels of hate crime. There's a really dire situation for transgender and gender diverse young people as well, where the gender identity service has been almost in a state of collapse for the past 6 years or so. There's people who've been on that waiting list since 2018 and have had to go throughout COVID and throughout all of this without any access to healthcare, without even getting a first appointment. So really the Rainbow Project provides vital support to countless people and receives, you know, very little funding to do this work. You know, we've developed a positive relationship with politicians across Northern Ireland and, you know, with yourselves in Derry and with the Belfast City Council. We've been working in Belfast actually to establish a new LGBTQIA plus centre with the council in the heart of the city. And, you know, we've been able to work closely together to kind of ensure that we're getting into funding streams and that we hadn't previously accessed. And we would love to keep that same relationship with yourselves in the Derry City and Strabane Council as well. We also want to ensure that where council are consulting on policies or service delivery or any other issues which could have an impact on local LGBTQIA plus communities, that there is adequate kind of consultation with communities on the ground and proactive outreach. You know, our staff, as you can hear, we do a lot of work, and most of that work is support and service delivery. So we don't necessarily have the capacity to be looking at all the consultations and responding to every kind of call out that council puts out. But we still want to ensure that we're kind of feeding in on issues that might be relevant to our communities. So we would really love to say have something like a quarterly meeting, either with officials or council members and our centre staff here in Derry to provide updates on issues affecting the community, issues arising from our side, and also kind of receive updates on council initiatives that could impact or benefit the community and how we can kind of positively engage in those initiatives. And I think that keeping this kind of regular engagement going with the council would help build on that kind of already positive relationship and ensure that we're kept in the loop regarding, you know, funding streams or new initiatives and programs and anything like that. And, you know, we would also very politely request that, you know, if you can, that you take kind of proactive steps to reach out and engage with our communities, even outside of if we do establish those quarterly meetings, to ensure that we don't miss consultations or opportunities for input where LGBTQIA plus communities might be affected by changes in policies or services. Thank you, James. Finally, I'd just like to kind of appeal to all of you kind of here in the chamber as political representatives, as members, kind of, you know, upstanding members of the community, to kind of step up and act in response to rising levels of hate crime and hate expression in Northern Ireland, not just kind of in Derry and kind of Foyles surrounding areas, but kind of across Northern Ireland. LGBTQIA plus communities and specifically trans individuals have been the target of quite a vicious and vitriolic hate campaign and moral panic from across the media and political spectrum, kind of particularly in Britain, but we see elements of it here in Northern Ireland as well. Trans young people, and particularly trans women, have been the main targets of this campaign, but it affects the whole community across the board. From my perspective, council needs to ensure that you're doing everything that you can to develop and promote positive messages around LGBTQI plus inclusion in the city. Coming in crossing the Peace Bridge and seeing a rainbow crossing was just really, really, really powerful to me every time I come to Derry. It's lovely to see, but sending that positive message at every possible turn that LGBTQI plus people are welcome in Derry and in the surrounding areas, and that anti-LGBTQI plus hate is not. While, we may all have our political differences, LGBTQI plus people are people, we're human, and the constant kind of debate around our lives and our experiences and our identities really has an impact and takes a toll. So, our communities need to know that council and all its elected representatives who have responsibility to promote positive and respectful dialogue stand with us against this rising hate. And I thank you all once again for inviting us in and having us at this deputation. And I'm happy to take any questions that you have. Thank you.
Thank you very much, Alexa, and please pass on our thanks to James as well. I had visited the Rainbow Project a number of months ago with some other political representatives and found it really, really insightful. The building in itself, it's incredible. It's from looking in, literally physically looking in, you think it's just a small building, but when you actually go on, it goes really far back and is quite big. And you can see even from that there are loads and loads of services and activities that go on there. One of the outcomes of that particular meeting was this deputation, and it was an opportunity, hopefully, for the Rainbow Youth Project to engage with elected representatives, but also with council officials as well, and hopefully build those relationships and open those doors to some of the things that you talked about within your deputation. So from my own personal point of view, and hopefully from the committee's point of view, which you'll hear from other members, it is definitely something that we should be looking at, in my opinion. Any form of hate crime is absolutely wrong, regardless of where it is, and we all should be. And I know many members of this committee and of this council do speak out against that, regardless of whether it's contained within this council area. It's wrong and it shouldn't be happening. And hopefully that's another collective voice that we hear coming out of this meeting today, where we stand up and say that LGBTQI plus people aren't welcome in our community. They are our community, and they belong here. And the hate that is forced upon them does not belong here and does not belong in society at all. And we stand with anyone who is a victim of that hate crime, and we speak up and stand up for them when is required. And hopefully that comes out of this committee today with a loud voice. I am going to open up now to some of the members for some questions or points. And the first member is Councillor Paul Boggs.
Good Chair, and thank you very much, Alexa, for your presentation. Like the Chair as well, just to pass the thanks on to James as well for a very informative presentation. I am a councillor in Strabane, so it's about 14 miles outside of Derry City Centre. It does exist, against unpopular belief. But I, even before being a councillor, would have worked very closely with the Rainbow Project in terms of referrals to Strabane. It's fantastic to see that we do have those services reaching beyond the cities, because I think there is definitely a lot more work to be done, but our cities are becoming much safer spaces. Our towns and our rural villages have a longer way to go than maybe our cities do. And, when you talk about the rainbow out the front of the Guildhall, yes, very, very welcome. But you talk to young people in Strabane or Castleberg or as far out as Ahiarn, you may not even get to talk to those young people because those areas are not in the same space that our cities are at. And I think that's something that, as elected representatives, along with yourselves and all the agencies and the community and voluntary sector that you work along with, I think it's a shame that we still need to fight those battles and make progress in those areas. In the previous presentation, we talked about Councillor Deeney being a teacher. I taught with Councillor Deeney up until very recently, and I'm sure would agree with me, our schools in particular, while some are doing fantastic work, some have to do much, much more. And while a very proud teacher at that time in a Catholic maintained sector, I think that area in particular needs to do a lot more to broaden the horizons in terms of LGBT young people feeling safe to access the services, being safe to be who they are in the first instance, but then they have the confidence and the courage to be able to access services through agencies and organisations such as yourselves. And I know that in Strabane, that just isn't happening at the minute. While there is great work from yourselves in terms of the youth cafe, having more of I even think about Foyle Pride Festival having more of a presence in Strabane around Pride events and so on and so forth, and maybe one day the prospect of having a Pride Parade coming through Strabane. It's been done in Ulster and other rural areas, but we just haven't got there yet, and I think that again is something that all members in this chamber need to work very hard with agencies like yourselves and Foyle Pride to progress on. But I think in relation to the funding, certainly whatever engagement we can have with council, and I know there are grant aid funding opportunities and that there, so whatever can be picked up from yourselves, like other groups, we would absolutely welcome you to apply. Whatever we can do corporately as a councillor, and I know you're saying there about, you know, only between 5 and 10 councillors serving a massive need, and in one way, it's dire to see that there is so much need there that needs help and support. But in another way, it's absolutely fantastic that people are reaching out and engaging with those services. So I don't know if you want us to highlight that at a corporate level anymore, because it would add more work to your entree. But obviously, very important work. Bring it on. I'm glad to hear it. Good stuff. But just to make those points about, I would urge that. And more than happy to engage, and I'm sure all our councillors from the rural area as well, more than happy to engage about how we can best support particularly young people in the rural areas. And on that note then, any future engagement, and I'll hold my hands up and say that I haven't yet visited the centre like the chair has in Derry, but would perhaps love to do so if an invite was there. So any future engagement that ourselves and Sinn Féin can have, particularly rural councillors, more than happy to engage with these further. But thank you very much again on behalf of Sinn Féin for the presentation.
We'll just take a couple, Alexa, and then we'll come back to you and allow you to respond. Perhaps if there is going to be that quarterly meeting, maybe the first one might take place in the Rainbow headquarters here in the city, and allow people that opportunity to see the building. But the next indicated speaker is Councillor McDade.
Thank you, Chair, and apologies for being late. I was on a course from work. Thanks, Alexa, for the presentation, and as everyone said, thanks to James as well. I suppose just a couple of points first. I mean, the first thing to look at, 120 minimum people per month being referred through is just unbelievable. Those are massive numbers, especially for, as Councillor Boggs says, 5 to 10 councillors. That's no wonder the waiting lists are long, because that's just untenable, isn't it? You know, and I think I had written it and then you said it, was that this is the result of a failing kind of statutory service, isn't it? You know, and I work in the trust and I work in mental health, and I can see a need for staff training, for awareness training, and we do the equality training, and you kind of touch on all the different minority groups, but actually you probably need more training. We need more training specifically around this group, around the LGBTQI plus group. So one of my questions was, do you do training within the trust? Do you go in and provide it? Is it something that you would be able to provide even within mental health services to patients? Would it be something that we could work together in that respect? I suppose within the SLP, we'll do everything we can to support with funding and that as well. Whenever you were talking about what you're doing with Belfast City Council sounds really interesting to me. And then obviously, if we're talking about a quarterly meeting, I don't know whether Chair you'll allow it, but maybe a proposal could be that we would set up a working group working towards this, and then have our quarterly meetings coming out of the working group as well. So it keeps us all informed, and then it informs yourselves as well within Rainbow about what's coming in. It's a to and fro, and you know, we can share all the information across. So if everyone was happy enough with that proposal and you allow it, I think it would be something I would like to do. I don't think I had any other questions other than just the one about the training specifically for it. I think statutory services, I think, is something personally that I can see we need. And just to say, we, within the SDLP, we support it. I mean, like, it sounds, it's vital. What your services is vital. And I'm sure on a number of occasions has been life-saving for people. So thank you very much for everything you do. Thank you.
Thank you, Councillor McDade. In regards to the proposal, I'm happy to allow a proposal coming because I think it is really important, and rather than delay any proposal coming at the next committee or full council or whatever, let's have it addressed today. I think most would be in support of it. So if you could, whilst we're going to the next speaker, get that in writing and up so we can see it, but I'm happy to allow one. But we'll move to the next speaker is Councillor Duffy.
Thank you, Chair, and I'm happy to second any proposal. But Alexa, thank you so much for coming today. To you and James for giving the presentation. I think that it's really important that we do engage. It's really important that your voice is heard within this chamber. It's really important that we understand the issues that you are facing, and that we, when we as decision makers, that we can hear your voice and understand your needs. I think in terms of this council, I think we have been quite progressive over the years. I myself have been in and out of the centre since it actually was in Queen Street. Great relationship, particularly with Emer over so many years. She does absolutely tremendous work. She has been to the fore of nearly everything that has been going on. She is just a dynamite in terms of what she does. I think in terms of this council, and I just wanted to say, last year we held LGBTIQ plus Awareness Week within the Guildhall. We thought it was really important that, number one, we launched it in here, but we also had a health and wellbeing day in the Great Hall next door. And I think that that was particularly important to the Rainbow Project in terms of making sure that there was visibility, making sure that it was out there, that this is a safe space, that this is a welcoming environment, and everybody is part of our society, and this is where we're at. And I thought that that was a really powerful event, and we had mermaids up, we had here up, we had different people who don't normally be in the city and don't normally have an opportunity to tell their stories or have their voices heard. And some of the, particularly mermaids, I have had a number of engagements with them over the years. Some of the work they do, it just brings you to tears every time I talk to some of the mummies, particularly involved in that group. It just brings me very emotional when I talk to them. But I think in terms of the positivity around it, I think that we have to grasp that. I think that we do need to have the quarterly meetings of engagement. I think that it's really important because sometimes we do have consultations, we have events. We assume people know what's going on. We assume that if we put up a post on social media, everybody's reading it, everybody's engaged with it. 9 times out of 10, they're not. And, you know, it's so that's where it's really important that we make sure that we are really as inclusive as we possibly can. We did set up a number of years ago, and here our civic forum, which was around addiction, homelessness, mental health, to ensure that we were hearing all those voices. So absolutely, it makes perfect sense that we need to hear the LGBT plus community as well. I think that one of the things that I have done over the years in conjunction with the Rainbow Project, I work in homelessness, and I think that, you know, we talk about mental health, we talk about sometimes chaotic lifestyles, and we talk about the difficulties that people can face. And a lot of times, people who are coming through homeless services are part of the LGBT plus community as well. We did a lot of work with a guy, Jeff Perotti from Chicago, around safe spaces. And First Housing, where I work, we became one of the first homeless services within the north to become that safe space. I don't think that we have achieved everything that we set out to achieve, but it was a good first step. And we had, I don't know if you know Martin McConnell Oak, one of my very good friends. Martin was working within First Housing at that time and sort of led that initiative for us. Since he's gone, we've sort of you have that gap. So I think it would be really important to have that engagement again to make sure that we're not letting our standards slip when we have moved forward on things, that it doesn't take steps back. So I would be really, really keen to ensure that those engagements continue. I think it's really important work. And I think as a society, you know, we're better when we work together. So absolutely, Alexa. And thank you so much for coming today. Appreciate it.
Thank you, Councillor Duffy. Alexa, back to yourself. If you want to address any of those points.
Yeah, I mean, I'll take them all. So, well, first off, I'm from Newry myself, which is, you know, rural enough in the grand scheme of things. So I completely agree with your point around the specific needs of those in rural areas who don't get that visibility, who don't kind of get maybe access to all of that support. And, you know, I think there's certain amounts of things that you can do with good transport links and good, you know, links into the city, but we need to make sure that people are supported in their own communities as well. And that's why we have those kind of regional support groups. We have regional outreach as well, that we're not just kind of expecting everyone to come to Belfast or come to, you know, Derry City, that, you know, we kind of meet them where they're at. And so that's a really important point. Secondly, we do offer training to statutory services. We just employed a training officer. So yeah, please, you know, get in touch with ourselves with regards to any kind of training needs. I've done a lot of training specifically with mental health professionals as well. And I think that's definitely somewhere where we need to do a lot of work. And yeah, no, I think that, you know, anything that we can do to build on the relationships and build on the kind of support that council has delivered to us, you know, I believe it's 12th to the 17th of May is this year's LGBT Awareness Week, kind of ending with Ida Hobbit, the International Day Against Homophobia, Biphobia and Transphobia. So, you know, if council want to work with ourselves to do anything around that week, obviously that would be greatly appreciated as well. And yes, just to say thank you all again for the support and for having us in and being so interested in all of our work. We really appreciate it.
Okay, Alexa, thank you. I was just reading that. Sorry, my apologies. I was reading that proposal there, just to make sure that we're going to, it's within our standing orders. And one thing, Laura, which I think it is, it has been obviously proposed by Councillor McDade. Councillor Duffy did indicate that she was going to second it. I don't know whether she still wants to, but
And apologies, and it's.
you have to just bear in mind that she was thinking on the hop here.
I absolutely appreciate that you were thinking on the hop, and I don't want it to get pernickety or to be playing about with it. And I will say it in front of, sorry, Chair, I didn't even ask to come on, did I? Sorry, I'm here anyway, sorry. I'm getting too confident in this committee. I hope that Alexa will appreciate the point that I am just about to make, and I hope that the proposal of the proposal will appreciate it as well. I think it might be beneficial to us if we are dealing this as a collective LGBT issue within council and how we better support all services, that we don't make particular reference to the Rainbow Project, but rather any relevant organisation within our city and district that helps to support the LGBTQIA plus community. So therefore, where the Rainbow Project is mentioned, and I hope you're not going to ask me now to send it in an email, but where the Rainbow Project is mentioned, that we have all relevant LGBTQIA plus groups or services. And I hope, Alexa, that isn't taken as a dismissal of the good work of the Rainbow Project. But I think if we're going to set up a working group, it should be a collective of all those agencies that work in partnership and together, and where funding is available for the Rainbow Project. And hopefully you will find opportunities to apply for funding. But if the Rainbow Project are applying, that any other group as well that supports that same community feels that they are able to apply as well, and that we aren't favouring one group over another. Chair, Mugget.
I just say it just means that in terms of here NIE and mermaids, and that they can all have, if there's an interest that they wish to be part of something, that they can be part of it as well, because I think the work that they do is absolutely fantastic.
Okay, can you send that in an email? And I'm being pedantic now, so. As long as the Paula is happy that she's got the right wording.
So we have to shoot on for a wee train back to Belfast.
Oh, God.
So I know.
Well, we promise.
All right.
Okay, members, we have amendment on the floor, which I think is proposed and seconded. Shannon, yep. Everybody's in full support. We understand the rationale for the amendment. So happy that the amendment is passed. Yep, okay. And again, on the substantive proposal, everyone content it's passed? Yep, that's unanimous, both the amendment and the substantive proposal. No further questions or points on the presentation? No, all that's left for me to do then, Alexa, is to thank you, and James and everyone at the Rainbow Youth Project for all the work that you do, but also for your attendance here today. I certainly, as a member of this committee, look forward to our quarterly meetings coming up. I think it will be good for all of us, not just for the staff and volunteers and service users of the Rainbow Project, but for us as elected representatives as well. And hopefully it's something that we can build relationships on and help support the work that you do as a council corporately. But once again, thank you very much for your attendance. I'm not going to ramble on anymore because I know you have to catch a train to Belfast and I don't want to hold you up. So thank you very much for your attendance. Very, very welcome. Thank you.
Thank you all. Thank you.
Okay, members, there are no further items on today's agenda. So I'm now happy to declare this meeting is closed and thank you all very much for your attendance. As was pointed out, our first deputation committee section are working with them to try and get them back on at a point that's convenient for everyone involved. Okay, thank you.